Have you ever found yourself standing in front of the mirror or realized in a quiet, private moment that things don't quite feel as strong as they used to? Perhaps it didn't happen all at once. Maybe it came on gradually. A subtle decrease in fullness, a slower response, a sense that something you once took for granted now takes more effort or doesn't respond at all. And if you're truly honest with yourself, perhaps a quiet voice in the back of your mind has already begun whispering something troubling. This is just aging. This is what happens after 60. I guess this part of my life is over today. I'd like you to stop for a moment because that idea is not only incomplete, it's frequently incorrect. What if I told you that one of the most effective tools for bringing back blood flow, fullness, and vascular responsiveness has nothing to do with blue pills, injections, or expensive supplements hidden behind aggressive marketing? What if I told you it's probably already in your kitchen, perhaps right next to your flour? I'm referring to sodium bicarbonate, plain ordinary baking soda. Why this isn't just aging. Now I know precisely what you're thinking. Doctor, how can something I use for baking cookies possibly help with my performance? Stick with me because in today's video I'm going to guide you through 5 clinically supported, frequently overlooked ways that bicarbonate can help vascular health and what occurs with size, responsiveness, and confidence when blood flow isn't restricted anymore. If you're in your 60s, 70s, or older, and you've sensed your edge fading, know that you're not alone and you're certainly not broken. In many situations, what you're experiencing isn't permanent loss. It's restricted circulation. Think of it like rust in the pipes, rather than damage to the entire system. Before we continue, take just 2 seconds to tell me in the comments where you're watching from. We have men joining from or around the globe, and realizing that community exists means more than you might think. And if you feel men deserve shame-free evidence-based health information, press the like button now. It allows this video to reach men who are suffering in silence. My name is Dr. Selena Clarke, the vascular restriction myth explained. I'm a board-certified urologist with more than a decade of clinical experience, and my practice has focused almost entirely on helping men over 50, 60, and 70 maintain their prostate health, sexual wellness, and long-term vitality. Everything shared here is educational, clinically informed, and intended to support, not replace care from your own physician. Now let's confront a harmful myth directly. There's a common belief that once a man goes beyond 65, his body naturally shrinks, weakens, and shuts down with nothing that can be done that isn't biologically correct. In many men, what appears as permanent loss is really vascular restriction. Picture your arteries like garden hoses over years. Inflammation, oxidative stress, and acidity buildup. Stiffness. Creating a kink in the hose when pressure falls, flow reduces. Responsiveness diminishes. Tissues seem smaller, but the hose itself hasn't vanished. It just needs clearing, not replacement. This is why my method focuses not on miracle cures or empty promises, but on optimizing your internal environment so your body and any prescribed medications can function as intended. Why pills and supplements often stop working, and this is where bicarbonate comes into play. Method number 5, local circulation and tissue elasticity. Your skin isn't a solid barrier, it's a semi-permeable membrane. When tissues get congested with metabolic waste and local acidity, elasticity decreases. Blood vessels under the surface find it hard to expand freely. By applying a localized alkaline soak, you use osmotic pressure to softly rebalance tissue pH. As inflammation subsides, microvasculature opens up, elasticity gets better, and blood volume rises naturally. It's similar to taking a tight rubber band off a sponge. Suddenly it can absorb once more. Method 2 tablespoons aluminum-free baking soda in warm water. Soak for 10-15 minutes 3 times per week. Precautions: avoid if there's broken skin or active infections. Rinse thoroughly afterward. Moisturize if your skin feels dry. Men frequently mention something surprising here. Not only physical changes, but psychological relief. When tissue appears healthier and responds better, confidence starts coming back quietly and naturally. Baking soda. What it really does in the body as we get older, kidney function decreases. This leads to low-grade metabolic acidosis, a state associated with muscle fatigue and vascular constriction. Acidic blood causes vessels to tighten. Bicarbonate serves as a buffer, gently pushing internal pH toward balance and signaling smooth muscle tissue to relax. Relaxed vessels lead to improved volume, better response, and reduced internal resistance dosage. 1 teaspoon baking soda in water, taken on an empty stomach in the morning. Notes a slightly salty taste is normal. Adding lemon can improve palatability. If you have high blood pressure or sodium restrictions, check with your doctor first. Many men describe this change as feeling fluid once more, like letting go of a parking brake they didn't realize was on. Now that you see how alkalizing the internal environment helps clear the pipes, we should discuss something equally important: Why so many men do all the right things, yet still don't get results? This is where frustration grows because many of you watching aren't negligent about your health. You've tried supplements, nitric oxide, boosters, beet powders, L-arginine, L-citrulline, even prescription medications, and still the results seem inconsistent, weak, or temporary. That's not because those tools fail, it's because they need the proper internal environment to work. And that leads us to method number 3, arguably one of the most overlooked keys in male vascular health. Method number 3. Nitric oxide protection. Explained. Nitric oxide, often abbreviated as NO, is the master signaling molecule for vascular dilation. It instructs your blood vessels to relax and allow greater volume. That's why many therapies focus on boosting nitric oxide. But here's the reality. Most men aren't told nitric oxide is fragile. In an acidic, oxidative, inflamed bloodstream, it breaks down nearly instantly. It's like striking a match in a windstorm. You may light it, but it won't stay burning. Bicarbonate doesn't produce nitric oxide directly. What it does is shield it by lowering oxidative stress and buffering acidity. Bicarbonate creates a calmer internal environment where nitric oxide can stay active longer, and that transforms everything. Instead of a short response followed by quick fade, you gain sustained dilation, more consistent blood volume, and a returning sense of reliability. This is the consistency phase, and psychologically, consistency is incredibly powerful. When your body begins responding predictably again, you stop second-guessing yourself. You stop feeling like you're throwing money away. You stop feeling betrayed by your own body. You regain trust how to use this strategically. Take 1-2 teaspoon bicarbonate in water about 30 minutes before nitric oxide boosting foods or supplements. Think of bicarbonate as the stage crew setting up the environment so the main performance can truly take place. And this isn't about pursuing extremes, it's about keeping a steady state of readiness, and there's a medical term you might not have heard, but it explains much of what men face after 60. It's called inflammaging chronic low-level inflammation that builds slowly over decades. This type of inflammation doesn't cause sharp pain or send you to the ER. Instead, it quietly alters tissue structure over time. Inflammation leads to fibrosis, the accumulation of stiff, non-elastic tissue. And here's why that matters so deeply. Even with perfect blood flow, fibrotic tissue can't expand properly. It's like trying to inflate a balloon made of cardboard rather than latex. No amount of pressure restores flexibility unless the tissue itself heals. Bicarbonate has been shown to reduce inflammatory markers like C-reactive protein, helping slow this destructive process. When inflammation decreases, tissue elasticity improves, expansion, capacity returns, and comfort grows. Method Deborah 4, metabolic acidity and blood flow. This isn't only about function, it's about dignity. Recognizing that your body can stay healthy, responsive, and intact well into your 70s and 80s is profoundly empowering. It shows you that aging is something you can engage with, not something that simply happens to you. How to apply this safely. Follow a pulse approach, 1 teaspoon bicarbonate daily for 5 days on 2 days off. This avoids dependency and lets your body keep its own buffering systems. One of the most underestimated parts of men's health is anticipatory anxiety. When your body has disappointed you repeatedly, your brain begins anticipating failure. That expectation by itself can limit blood flow. By enhancing internal chemistry and tissue health, many men report not only physical improvements, but also less performance anxiety. Your body no longer feels like an opponent. It starts feeling like an ally again. Method number 2, inflammation, fibrosis, and stiffness. Method 1, the Golden Morning Tonic. This is the most powerful, balanced, and practical way to use bicarbonate. It combines bicarbonate with potassium citrate and lemon. Together, these create a synergistic effect. Potassium balances sodium to prevent unwanted water retention. Citrate further alkalizes, urine and blood bicarbonate buffers acidity. The outcome is a gentle system flush. Like clearing static from a radio signal, suddenly communication between your brain and blood vessels gets clearer. This is why men often notice better morning responsiveness with consistent use. Recipe in 8 ounces filtered water, 1-2 teaspoon baking soda, the juice of 1/2 to 1 fresh lemon routine. Drink 20 minutes before breakfast, before coffee or supplements. Safety note. Men with chronic kidney disease must not use this without direct medical supervision. Starting your day this way does more than just chemistry. It sends a message to your nervous system. My vitality matters. That mindset change often results in better food choices, more movement, improved sleep, and greater self-respect. And those shifts compound health turns into a virtuous cycle, not a struggle. Now that you know why bicarbon, it works, how it aids vascular health, and where it fits in the bigger physiological picture, it's time to make this information practical, because knowledge Knowledge without action just breeds frustration. I don't want you leaving this video thinking it made sense, but still unsure what to do tomorrow morning. So let's create a plan, a realistic one. Not extreme, not costly, not life-consuming, just a clear, structured approach. You can truly follow the 30-day Vitality Reset Plan. This is the same phased approach I suggest in my clinical practice because it honors how the body adapts phase 1, days 1 to 14, clear the rust. Your focus here is internal chemistry. Every morning, 1 teaspoon baking soda in 8 ounces water with a squeeze of fresh lemon. Drink it 20 minutes before coffee or breakfast. That's all. No stacks, no overload, no chasing sensations. Think of these first 2 weeks as clearing the pipes. During this phase, some men notice better digestion, reduced morning stiffness, slight warmth or heaviness in the pelvic area. Positive signs of improved microcirculation, phase 2 days 15-30. Improve elasticity and flow. Now gently add the external component. Continue the morning tonic. Add osmotic, soak 2 times per week for 10-15 minutes in warm water with baking soda. This phase emphasizes tissue responsiveness, not just blood delivery. You're letting internal changes become structural improvements. Let me be straightforward. Some of you watching are thinking, Doctor, I just want the simplest thing with the biggest payoff. That's understandable. If you do nothing else, stay with the morning drink. That internal pH shift is the strongest lever for vascular health. Everything else is additive, helpful but not essential. Let's be completely clear. You won't wake up tomorrow with the physiology of a 22-year-old. That expectation only brings disappointment. This is medical science, not magic. What most men experience instead within 2 to 4 weeks is greater warmth, returning fullness, better morning responsiveness, more consistent performance, and less anxiety around function. Those changes are gradual, sustainable, and building over time. That's precisely what we aim for. Not chasing fantasy, but protecting function, confidence, and dignity. What realistic results actually look like. The bigger picture, why this actually matters. What you're truly doing here isn't merely improving circulation. You're telling your body, I'm still paying attention, I'm still invested, I'm not giving up on myself. I see men in their 70s and 80s every week who maintain outstanding health, not because they're lucky, but because they honor the small details. Internal pH, inflammation control, vascular health, consistency. These things compound over time. Too many men suffer in silence because they think this topic is embarrassing. It's not. It's biology. Ignoring it doesn't make it disappear. It just robs years of quality from your life. You're not weak for caring about your vitality. You're responsible. Final message, dignity, confidence, and aging. Well, call to action and next steps. 1, drop a comment below. Which step are you starting with, the morning tonic, osmotic, soak, or both? 2, hit the like button. It helps this video reach men struggling quietly. 3, subscribe. I share new evidence-based strategies every week, specifically for men over 50 who want to remain strong, functional, and confident. 4, share this video. Send it to one friend who might need it but won't ask. Let's end the silence together. Gentlemen, aging doesn't mean surrender. What you've gone through is a biological shift, not a final verdict. You have options, you have agency, and now you have a plan. I'm Dr. Selena Clarke, and remember this, vitality is a practice, not a destination. And I'll see you in the next video.